All right. Well, welcome everyone. We'll be starting the webinar in just a few moments. Thank you for joining. Great. Okay. All righty. Well, welcome everyone. We'll be starting in just a few minutes. Thank you so much for joining. All righty. Hey. So welcome everyone to the Local Oral Health Program panel presentation on establishing a Memorandum of Understanding webinar. And thank you for joining us today. My name is Keiko Miyahara from UCSF, California Oral Health Technical Center, and I'll be hosting today's presentation. So today's webinar is an informational session for the special one-time funding opportunity to expand evidence-based school dental programs using best practices approach that will promote oral health, leading to sustainable clinical models. So some housekeeping before we start. Everyone is muted, so if you experience any technical issues, please use the chat box to connect for help. Please use the Q&A box to ask questions during the webinar, and this presentation will be recorded, and the recording will be available on COTAC's website. And also, you might have received several documents, including speaker bios, agenda, and sample MOUs that were sent out this morning. Please let us know in the chat box if you have not received those documents. So today we have speakers from 4 counties that'll be sharing their experience with MOUs. I'm delighted to welcome our first speaker, Dr. Shikalpi Pendekar. Dr. Pendekar is the director of San Mateo County Oral Public Health Program, where she oversees implementation of the San Mateo Local Oral Health Program. Dr. Pendekar is the founder and chair of the Collaborative for Oral Health in Santa Clara County and advisor to the Santa Clara County Local Oral Health Program. With that, I would like to present Dr. Pendekar and turn this over to her.
Thank you, Keiko. Good afternoon, everyone. I'm so happy to be here sharing some of the information that we've used in San Mateo County as regarding MOUs. And so I just labeled it MOU 101 since some of us here might not have had any access to MOUs or to know how to do MOUs. And I'm hoping that the information that we will all be sharing today will help those who are new to the MOU world. So MOU is, what does it stand for? Memorandum of Understanding. Next slide, please. Keiko, I'm not seeing the slides correctly displayed. Do you want me to share instead? Let me, okay.
Do you see the screen
Yes.
right now? Okay, Let me do a presenter view.
Okay, try the next slide.
Okay. No, it's not going through.
It's not going through.
Yeah.
Okay, if you
Sorry
stop
about that.
share, that's all right. I can try to share my screen. Let's see.
Great, thank you.
Sure, no worries. Are you able to see it?
Yes, Dr. Pendekar.
Yes, okay. And is it Is it going through the next slide now? Because I can't tell.
Yes, if you can also do a presenter presenter view.
Show? Okay, let me see.
Yes.
Does that show now?
It's working.
Let's see. Sorry about the technical glitch. Is it showing now? Yeah.
It's showing now. Thank you.
Okay, perfect. So the reason I have this slide up here, it talks about the mission for San Mateo County's Family Health Services. It's always helpful to align the mission for your local oral health program with your counties or your parent program where you might be housed. In most counties, the local oral health programs might be housed within either Family Health Services or within MCAH or CHDP. And so depending on where you are located, it's good to align your mission of your program with that of your public health program where you're housed. So in our case, our mission is to help everyone in San Mateo County live longer and better lives. And so the MOUs that we have developed mostly are all focusing on partnerships and collaboration. And we worked with different programs within and outside the counties within and outside family health services to work together to move our program forward and also align it with the programs that we are partnering and with their strategic plans as well. So just to go ahead and give you an overview. So what is an MOU? First of all, I just want to say when I came on board with this program in San Mateo County and started my work for implementing our local oral health program, I really didn't know much about MOUs. So for those of you in the audience today who are new to the concept of Memorandum of Understanding, you got this. Nothing to worry about. Don't worry. Today you're going to hear from 3 other counties and they will share their experiences as well. Some of them have had a lot of experience developing MOUs and some of them are new to this as well. But the idea for today's presentations is for everyone to sort of get the gist of it and to feel very comfortable with the concept of MOUs. So what is an MOU? An MOU is a Memorandum of Understanding. And why are they important? They are important so that you have an understanding, a document between a legally binding document, if you will, between usually 2 parties. And so it identifies what are your shared goals and how are you going to move forward with the work that you intend to do. So how do you get started to develop an MOU and what information should the MOU contain? So some of the things to consider when developing an MOU. Usually within your public health department where you are located, where your program is housed, you will have someone who is assigned to sort of create the MOUs and move those MOUs forward, because the MOUs will start out as a draft. And then once you have a draft of the MOU, then that MOU will move forward maybe to the legal department, to the county council, to look at it, to make sure that everything is legally binding. And there's a lot of terminology and language in the MOU, which can be confusing. But I think from your point of view, what you want to make sure is that you want to identify which partner you're going to be working with. So for example, if in my case, it might be a local community organization or a FQSC, and we have a partnership with that FQSC. So we will have information related to that partner organization in that MOU. And then the time frame for the MOU usually would be based on, most of the work related to the Prop 56 program. The grant, as we all know, is ending next year. So you might want to put that term up to June of 2022. But in some counties, such as in Alameda, for example, they've got, an existing program, and LOHP or the Prop 56 program is just a small part of that program. And so in such a county where they might have a existing program, your term does not have to end when the Prop 56 funding ends. In other words, your term could be based on how long you want to work with whichever partner organization you have identified. And then the list of things that you want to include. So there would be definitely the period of time, the partner organization. In our case, the person who works with the draft. So when we create the draft and I work and put into the draft all the information that I need to include in terms of what the MOU, who is going to be the partner organization with the MOU and the period and all those different logistics as to the scope of work. So, Keiko mentioned earlier that this MOUs today we will be discussing about the RFA for the school-based programs. So what is the scope in that particular implementation plan that you might want to include there? Is it regarding equipment or is it regarding data sharing? Once you've created all those list of logistics that you want to involve in the MOU and you send the draft then to the person who might then move that forward. So in our case, in San Mateo County, it is a management analyst, and the management analyst sits within the administrative and the financial branch. But it might differ for your particular local program. It might be housed somewhere else, but typically there will be someone who is assigned then to look at that initial draft, to make changes, to maybe get back to you and to suggest the changes that are required. And then, you move it forward from there. Once it goes to the county council is then going to look at all those things that have been outlined in the MOU, and they might have some questions, they might have some suggestions in terms of language, and they'll get back to you and they'll have you make those edits. So you go through the editing process, you make those changes, and then you would send it back. So there could be, sometimes there could be a bit of a back and forth in terms of, what materials you want in there and how the county council or your management analyst might think that the language should be. And they'll go back and forth between that. And then once that draft or once that is finalized, then usually that MOU gets sent out to the partner organization once you've signed. So in our case, for example, we get the Family Health Services Director. She's the person who will sign the final agreement, even though the agreement is between the local oral health program and the partner entity. The Family Health Services Director is the one who will sign that MOU, and then that MOU gets sent out to the partner organization, and they will have the same process usually on their end. So they will receive the MOU, they'll go through, looking at all the different things that are outlined in terms of who are we partnering, what is the scope of work. There will usually be, clauses related to termination. There'll be usually clauses related to what if something goes wrong, or what are the requirements, what are the deliverables from both the entities. So what is the local oral health program going to do, and what is the partner organization going to do? And they will look at all of that. And once they and their council have reviewed it, then the other person will sign it. So that is sort of the brief overview of how the MOU process works like. And you'll hear from some of the other presenters today more specific examples about the MOUs. I want to share some of the examples of the MOUs that we've developed for San Mateo County. So we've got one MOU, which I believe is on the Kotak site, the draft of that MOU. So we developed one that is to work with the school districts in order to help them with the COHA form collections and getting the aggregate data out to the score site. We piloted a school-based oral health program, and so there was one MOU between the San Mateo County Oral Public Health Program and the Bayshore School District, where we piloted this program. Then there's another MOU, which is for equipment and supplies with a community partner organization, Sunrisa's Dental Health, that they get some supplies from the local oral health program and for some of the preventive activities that they do out in the community. We have another MOU for the virtual dental home, which is provided by, the services are provided by Ravenswood Family Health Center, and they provide the services at this county-run WIC site and the MTU sites. We have one with UCSF with the Dental Public Health Program. And the dental public health residents, they come and they spend 1 year during the residency with the local oral health program for program planning and certain other aspects of which ties in with their coursework and fulfills their course requirements. And then, of course, the latest one is the MOU with partner FQHC to provide the school-based, school-linked preventive services, which is the latest RFA, which most of us have filled in the application for with the state oral health program. So these are just some examples, and I'd be happy to share any of these MOU drafts with anyone who wants to see them, or we can provide it to Keiko and she can have them posted on the COTAC website. But the idea of today's presentation is for all of you who are not familiar with MOUs to feel comfortable, to not feel overwhelmed, because it can be. In the beginning, when I first saw an MOU, it blew my mind because it was very confusing. But it is not difficult to navigate as long as you keep certain things in mind, and those would be, what is the MOU for? What is the scope of work? Who are you partnering with? And typically you'd have spoken with some contact or contacts within the partner organization regarding what work you want to do together and what are your shared goals and objectives. So once you've determined that, then you have to put those logistics into this document. And then the document goes through the different processes, as I mentioned before, with your management or your fiscal analyst or with county council, and then eventually gets signatures from both your end, from your program, as well as from your partner program. So this is just some pictures about the Bayshore pilot that we did a year and a half ago. And this is my information here. And we'd be happy to take questions at the end of everyone's presentation.
Well, thank you, Dr. Pendekar. I know we're having questions come in. So if you have any questions, please type it in the Q&A box and we will open it up towards the end of the presentation. Thank you.
Thank you, Keiko.
Thank you. All right. So moving on, I would like to introduce our next speakers, Mary Ellen Reese and Jennifer Rivera from Santa Barbara County. Mary Ellen is Executive Director of Children and Family Resource Services. Mary Ellen is an advocate for children's oral health and lead the comprehensive fluoride varnish program she initiated 12 years ago, which before COVID served as an average of 7,000 children per year in public health school settings and over 14,000 a year in pediatric medical offices. And Jennifer Rivera holds a Master of Public Health and Health Education and has 12 years of experience as a health educator. Jennifer is focusing on implementing and coordinating and evaluating programs to improve the quality of life of communities. Welcome, Mary Ellen and Jennifer. I would like to turn this over to you.
Thank you so much for inviting us to present today. We're excited to be here. So first, I wanted to show you a little bit about, our programs and how we got here. Just to give a little background, we're a little bit different than some of the other local oral health programs. We're part of our county education office. And we've been doing this oral health projects within health linkages for the last 14 years. And so we've got about 14 years worth of MOUs experience. And I had never heard of an MOU before I started doing this work. But we literally have hundreds and hundreds of MOUs because all that Health Linkages does is make connections with other organizations and have partners in all different types of sectors. So, and I started out as the Early Childhood Oral Health Program Manager with First Five funding. Then we started adding more programs and contracts and grants and expanded into older students. And then when fluoride varnish became a Medi-Cal benefit so many years ago, now it's just everyone's used to it, but at one time it was brand new. Our local oral health department didn't have the capacity to take it on. They didn't have a dental program. And so they asked us over at county education office to take it on. And as I always say, I'm just a social worker, but under the medical model, you don't have to be a dental professional. We know that we have medical assistants doing it in all the pediatric offices, and something that was once brand new, now we have about 15,000 applications happening a year. So these are our programs. We have home visiting program for newborn babies, as well as Medi-Cal and Promotoras programs. So we're talking about, what is an MOU? You've already got some really good information on it. These are the points I'd like to pick up on, and that's just that it is a formal agreement. So it's putting what you want to do in very clear terms so that you're all agreeing to what your parts are on a joint project. And it helps avoid misunderstandings of expectations. So a good example of this was, we were doing fluoride varnish for our preschool program. And then the question came up, oh, are we supposed to go back and do a second one? And so the answer was, well, let's go back and take a look at the MOU. What did we say we were going to do? Oh, we said we were going to do 2. So, or the question came up one time on parent presentations. Do we have to do 3? And honestly, I couldn't remember. This is why you put it down in writing. Was it 2 we said we were going to do this year, or 3? So it's a way to avoid misunderstandings and make sure everybody's on the same page. And like a roadmap. The other question we were asked to talk about was why they are important. And the first thing is that sometimes you can't even move forward on doing anything together unless you have one in place, depending on who your partner is. Oftentimes you're able to leverage other resources that you couldn't do on your own if you have an MOU in place with somebody else. Sometimes it's a financial relationship, and if that's the case, you definitely need to have an MOU in place. Sometimes there's projects that involve using shared property or other things where the partner might want to have proof of liability insurance. And so whenever we have to do this, the first thing that our insurance carrier always asks for is, what is the MOU? What is it exactly that you're going to do? I always like to include addresses and contact information where possible on my MOUs, because then it makes it very clear and easy if somebody else needs that information. And they might involve financial matters or not. It just might involve access to resources. It might just involve access to students for your program. So here's an example of why they're important. Here was something amazing we were able to do during COVID. And I show this because one MOU can lead to another. So because of one MOU we had with one school district, another school district kind of took confidence in what we were doing and was able to consider doing it themselves. And this was our drive-through oral health fair that we did during time of COVID when everything was shut down. And they were tentative about letting us do this, but they let us go, and we created a video of it and we shared it. And another district went ahead and signed the MOU with us and let us do it a couple months later. The other thing I want to share about working with schools is that in our county, we have 20 different school districts. And some of those school districts only have 1 or 2 schools. Some have up to 20 schools themselves in it. And this year, because of our relationships with the schools and agreements we had made, we were able to serve 2 different districts with drive-through events, and 5 other districts allowed us actual on-site access to students. But to show you how different each district can be, one allowed us on campus, and it was during one of the greatest spikes. I was very surprised that they did this. Another made us stay on the sidewalk, and some wouldn't let us come on at all. So when restrictions were relaxed in our county from purple to red and then to orange, some districts who had been completely virtual decided to return just after spring break. And I was sharing with people earlier that with only a couple months left in school, they said, come on in and screen our kids and let's do fluoride varnish. And we said, sure. We actually put it together an MOU within only a couple weeks. So, but because we had a history of having MOUs over various years with that district, it made it easier to proceed to do something new. So what are some other things to consider when you're developing an MOU? I always like to talk about, as it was already shared, about what is your purpose? I like to think about what is it that I really want to do? What do I want to accomplish? And try to think about what the end game is. And I think for me, that's more important than kind of the details of how it's written, but what is it that I want to be able to accomplish? So yes, an MOU gets very detailed, but try to remember the big picture. What is it that you want to start with? So you're going to develop a lot of details, but to start, I like to think about what's the end game. And as has been shared also, to talk and think about what your vision is. What is your mission? And so you want that MOU to help you accomplish that. How do you get started? For me, I think it's important to discuss with the leadership of your organization. For most of you, that's your local health jurisdiction from the very start. So I like to say, everybody has a boss, and even the boss has to answer to a boss. So, or a group of stakeholders, or the general public. So you always don't want to surprise folks with an MOU. You want to start right from the beginning and let people know what it is that you want to accomplish. Very important to know the culture of your partner. Schools are very different from counties and from public health departments. Sometimes not so different, but sometimes they really are a different kind of situation, a different culture that happens within a school. So you need to build your relationships, find your allies. Then you can start your MOU. This is what I like to tell people about schools. So think of your principal at the school as a king or queen, and the school is the kingdom. I know it sounds a bit extreme, but I'm telling you, the principal at the school really is like the king. They are in charge, and you need to respect their authority if you want access and cooperation. I know it sounds extreme, but schools are very territorial and very protective. Think about it. They set calendars and schedules very far, almost a year ahead of time, and they will not change them for anyone. Once they are set, they are set. They ring bells to tell people what to do and when to do it. They are very precise, not only in their days, but in their minutes, their timing for everything. So you have to be willing to negotiate. You cannot demand things from them. You need to ask and you need to listen to what their needs are. Certain times of the year, even my best friends at a school won't talk to me. The beginning of a school year, the end of a school year is usually a really stressful time for schools, and they have priorities they need to accomplish, and it might not always fit in with what we think our priorities are. So yes, you can put a plan together. You want to arrive organized and with options. You don't want to waste their time, but I would say do not plan out your details in isolation or have an idea that you're just going to have to do things a certain way, because sometimes that's not going to work out at a school, and it might be for reasons that we don't understand. And if it doesn't go well, they may totally shut you out. I always say this too, that I think with schools is that I do think that they need us. They need all of us to provide services for kids, but they might not think that. They have a certain mission and vision that they have. Where you find really the sweet spot is when the vision and the mission for both of us come together. I didn't have too much to talk about this question because we're not an LHJ, so I really couldn't give advice about this, but I will say that we as a county education office have set up agreements within our LHJ. So the length of time of an MOU, we usually do it for about a year, and we usually align it with our fiscal year. Sometimes it's for the length of a related contract or a specific funding period. Sometimes this was new when we started looking at equipment, was we wanted to look at what was the life of equipment. And this one, I had no idea. We had never done anything around equipment before with a partner. And it was actually our CFO. So it was our chief financial person that when he reviewed it, he had that question. And I said, that's a good question. So there's all kinds of different things that can come into play. Okay. Here are some of the important items to include on your MOU. You want to have the legal name and address of the organization, as I mentioned. It's very helpful when you need to use the MOU for other purposes. You need to have the names and titles of the signers with authority. And this can be confusing sometimes because sometimes the people you think might be the one to sign it, it's not that person, it's somebody else. So that's why I say always start with the end in mind, but start also with letting your boss, that person's boss, know about what you're doing. So it kind of like the senior leadership at an organization doesn't get surprised. So for us, we are Children and Family Resource Services. We're a nonprofit within the county education office. So sometimes I'm the one that signs. Sometimes it's my supervisor that's the one that signs. Sometimes it's the board of directors that signs. So, but that's what you need to find out, is find out for the particular contract or MOU that you're working on, who is the right person who's authorized, because it might not always be obvious. You always want to have clear dates, and you want to state what your purpose is. I like to include that as part of the MOU, right at the beginning part of it, what the purpose is. And we like to list the roles and responsibilities for each partner with bullet points. If there's financial arrangements, you want to be very clear and detailed on that here. And it might not be financial, it might be just that you have permission to do certain things or access to certain things. And I'm a big believer in templates. I know there's going to be a lot of examples that are given. And so you might need to find the one that fits right for you. Templates are good, checklists are good. I always say that when we do a fluoride varnish, I always go down to the basement to get my stuff. I go down with the list, because if not, I'll always forget something. So these are some other considerations to think about. Do you have a local in-house legal team or somebody that serves that purpose? The other thing is that MOUs can be modified when you're trying to put a draft together. So sometimes I think don't be so worried about what the details are going to be if there's some negotiations that need to go back and forth. Once they get signed, then that's another situation. But while you're in the process of putting a draft together, there's ways you can negotiate. The other reason that you want to think about MOUs and considerations is changes in staffing. So I'll give you an example. So we have a relationship with Allen Hancock, which is our community college in the north part of our county. They have a dental assisting program, and they volunteer with our program, and it's actually become a class where they do their community service hours. So here's a good example of, we just have this relationship, we've been doing it for years, but where an MOU is important is, what happens if the director of that program retires or moves on to a different position? Or what happens if I move on to another position, which actually I have. I'm not actually the oral health program manager anymore. Now I'm in a different administrative position, but I'm excited I get to still do stuff like this and be part of the local oral health program. So I'll give you an example here of how things can be modified. So recently we had, I had a MOU come back with somebody, and they had their executive director sign it and send it, and they said, just sign it and send it back, Mary Ellen. And I took a look at it, and I have to make a joke. There's a song by Hall & Oates called I Can't Go For That, if anybody knows that song. And I looked at it and I was like, I can't go for that. So everybody, you have to have your line in the sand. And for us, I was like, I can't go for that. Where did they come up with this idea, right? We were doing promotors, we're doing education, and it was a partnership with food distribution. And we were doing that, but then they sent back this clause and they sent me a job description of what they wanted people to do. And basically it was to take charge of the whole event. And I was like, sorry, no can do, can't do that. And then the other one, the real kicker of it was, I took a look at the dates and they changed it, and they wanted to change it to indefinitely. I thought, my goodness, indefinitely? I said, we're not getting married, we're just signing an MOU here. You can't indefinitely. So there's times when you have to say, nope, no can do. And that was that one. And it really made my staff laugh, because when we were talking about it, I put the song on in the background. And there's part of the song that goes, I can go for being twice as nice. And that's true. I think that will get you a long way in developing relationships with schools. And I can be twice as nice, but in this case, no, I can't go for that. Not going to happen. So the other thing I wanted to share about school culture, again, like my example, is that the analogy of the king and queen. And so if you think of king and queen, they have a castle. What surrounds the castle? A moat. Moats are what surround a castle. How do you get to the castle? Drawbridges. That's what the MOU is. It's what's going to get them to put that drawbridge down so you can go into the castle. And what I want to say is, it starts with the leadership, the superintendent of the district, the principal of the school. Once you have their buy-in, because they're the one that's in charge, then you can get the cooperation from the teachers and everybody else that you need to have. And my other advice is don't try to swim across the moat. You might get some flaming arrows shot at you. So make sure you get the MOU in place, get the permission, and then when you want to go into the school, they'll put the drawbridge down and let you in. They're very protective. Schools are very protective, not just of their students, but protective of their reputation. And that's not unlike all of our organizations, right? Oops. So this is just an example of some of the organizations we have MOUs with. It really is an amazing number of partnerships that we have. So what we're going to do is give you an example of one of my favorite collaborations that just recently happened, and Jennifer's going to tell the story of the practical applications and how it ended up working out for us. I told you 14 years ago, for 14 years I started doing this kind of work. I wanted to have a sealant program. We had fluoride varnish, but we could never bring things further on to do a sealant program. But now, because of Prop 56 and the State Oral Health Office, it's finally going to happen. And we have that success story. So I'm going to let Jennifer tell it. And it all happened just with MOUs that happened in the past. And then when things were all right and the relationships were in place, I'm amazed. We were able to just put an MOU in with almost no effort at all.
Hello, thank you, Mary Ellen. So my name is Jennifer, and I want to talk to you about the practical application. So as Mary Ellen has mentioned, you have to find your allies, or as we like to call the oral health champions in our community. So the way that we were able to sign the MOU for this dental sealant program is through various allies that identify themselves in the community. So we have something that's called a local collaboratives. For us, is the Dental Access Resource Teams, or DARTs for short. So during this collaborate meetings, we meet quarterly, and we have 3 for different parts of our county. We have the north, the middle, and the south. So during this collaborate meetings is when our local oral health program takes the chance to present any updates that we have accomplished with our local oral health program. And also we announce any projects of where we need help and how we can help or collaborate each other. And so during one of these DARTS meetings, we announced that we needed help with the sealant program, and we were looking for schools and dental organizations or dental providers that can help us get this started. And it was that way that one of the school nurses in one of the districts that particularly has been difficult to get in told us, I'm interested in this and I would want to volunteer. I know that I work with another nonprofit in the area that specifies in dental. And it so happens that we work, they're one of our champions, the Santa Barbara Dental Clinics in town. And so we already knew of the partnership. So we were reintroduced by the nurse. And then it just so happened that the dental provider said, we would be happy to do this. And then the question came back to the dental clinic. Do you have any specific schools that you want to work with? Because once the champion has identified themselves, we kind of just keep asking and just to find it if there's already a relationship that has been built, because then it's easier to get into the school or that district. So even though the district that recommend us and put us back in contact with a specific provider, the dental provider selected another district that said, this district, we already have MOUs with, and the principal is on board, and she's a champion for mental health. And so the idea from the center provider was we need to start with the school that we've already established, so that the other district that we have difficult with can see. And sometimes that in itself just helps. It kind of becomes a good rival, that if one district is doing it, they kind of, all the principals have a district meeting and they all meet. So they kind of want to always excel and be the first one. So word of mouth helps us in the community. So as of now, we already have an MOU that we have started with dental provider. We've already met with the school, and we already have dates in place of continuation meetings that we coordinate and we assist them. And so we are ready for the new school year to start pilot testing this. And just like everything else here in the community, it's just word of mouth, and everyone wants to be the best and everything. And so once we pilot test, I'm sure other school districts will be happy to model and be part of this big student program. So thank you so much for your time, and I hope this was helpful to you. If you have any questions, we'll be able to take them at the end of the presentation. Thank you.
Great. Thank you so much, Mary Ellen and Jennifer. That was great. All right. So I'm going to go ahead and move on to our third speakers. Third speakers are Dr. Deanna Aronoff and Yashvirkhar from Alameda County. Dr. Aronoff is a clinical director of the Office of Dental Health who implemented the school-based sealant program. Dr. Aronoff helped the dental public health community to understand the complicated guidance of the various government agencies involving dental settings and COVID-19. And also, Yashvirkhar is a registered dental hygienist, the program specialist at the Office of Dental Health, conducting school-based sealant programs for over 5 years. Welcome, Dr. Aronoff and Yashvir.
Thank you.
Thank you. Thank you for having us here today. I will be going over the PowerPoint presentation, and Dr. Aronoff will be sharing the example or sample MOU and other supporting documents that are helpful for this MOU. So the objectives for today's presentations are to, we hope to provide you an overview of the MOU process and help you understand the importance of establishing an MOU. And you'll be able to identify different components of an MOU and statement of work, and also know the differences between HIPAA and FERPA regulations. Like you have heard earlier, what is an MOU? It's an agreement between two or more parties. It's legally not binding like a contract. It is almost like a contract, but contracts typically involve, finances. In this particular case, in our case, the funding is from the local oral health program, so we are providing the services at schools. So it's less legally binding, if that makes sense. And it also outlines the expectations of each party. Why do we need an MOU? Well, it allows each party to state their objectives and expectations. It reduces the risk of uncertainty by assigning specific roles and responsibilities to each party. It provides a framework for the project, and it also prevents any potential disputes from occurring. And how do we develop an MOU? We have broken it down into 4 different phases. Planning phase, where each party determines what their needs are. Drafting phase, where local oral health program staff would draft initial MOU. Negotiating phase, where the school district and local oral health program discuss any potential conflicts. And final phase, where each party agrees to the terms and they sign and have a signed copy of the contract MOU. Who formalizes the MOU? In our county system, we prepared the draft. It was shared with the department attorney for review and any necessary changes. Once it was ready, it was shared with the school district, and their attorney reviewed and counter any changes. Once both parties had agreed, the final MOU was signed, and each party has a signed copy. MOUs are typically in place for a year initially, and you can, depending on the funding and the program, you can renew the 3 years. That's typically how we have the MOUs renewed here in Alameda County for the school-based loan programs. The information to include an MOU, you want to include the purpose of the agreement, the parties that are involved, all their contact information, timeline as to when the MOU is effective and when it ends, statement of work. In our case, it's part of the MOU, but this typically is the details of roles and responsibilities of all the parties involved. Confidentiality statement, insurances, process for and timeline for revisions, additions, and termination if needed, and necessary signatures of each party. So statement of work, it would include the program operations, activities, services. Is it the sealants that you're providing, or just the prophy and screening, or is it the fluoride? Those are things, those are the different components that you want to list in there or define. The roles and responsibilities of each party, and process for distribution and collection of the forms. That's the consent forms, and also any educational materials that might be shared with the parents of the students. You want to define your deliverables, what type of data is needed for all parties, and how that would be collected, and the reporting as well. Facilities and equipment, you want to define that the schools provide you adequate space where you could set up your portable dental unit, the operator and the patient chairs, couple tables where you could lay your supplies, educational materials, incentives. And the ventilation is very important, especially right now during the COVID times. So you want to make sure that, it's at least 6 to 12 room air exchanges. If there are HIPAA air filters available, if you're allowed to bring that with you to use if needed to be. And of course, please follow the current CDC guidelines when it comes to COVID-19 during this time. The regulations are changing. And make sure that there is a hand sink close by where you would be setting up with soap, paper towels, and foot operated trash bin. These are the details that we have added to our MOUs with our experience over the years. Sometimes the schools would try to place you in the teacher's lunchroom, or so these are the things that you want to think about when you're trying to implement a program. And also to have a process where you are coordinating or providing a dental care coordination, if that's possible, connecting the students to local dentists and those who are in immediate need, and also those who need dentist for their rec. And we also want to describe your process for handling a medical emergency, process for transporting and secure handling of the documents, Quality, that would be sealant retention check, done at the end of the school year. Other things to consider, privacy regulations, insurances and indemnifications, dental care coordination process, establishing relationships with the dental care providers for referrals, medical billing. In our case, we are not doing that right now, but if that's something that your program is dependent on, then you want to make sure that you lay that out as well. Positive consent versus opt-out consent by parents or guardian. We have seen that it's you get more participation with opt-out, and it gets a little challenging with the positive consent for screenings and sealants. So HIPAA and FERPA. HIPAA is a Health Insurance Portability and Accountability Act. That's a national standard that all healthcare providers are supposed to protect patient health information. And with schools and education institute and all the school staffs are supposed to comply with the FERPA regulations, which is Family Education Rights and Privacy Act. So here's a nice little table from CDC that shows the differences in HIPAA and FERPA and who is to comply. That was sent out this morning. Kika sent out that link. The insurances and indemnifications, so you want to make sure that also is included in your MOU. The general liability malpractice insurance for the providers who would be providing care, all those are covered in your MOU. And now Dr. Aronoff's gonna share the sample MOU we have. So please go ahead and take on.
Okay, here we go, hopefully. Let me get to that. Thanks, just a second here. Okay. So I hope everyone can see this. Is that visible to everybody?
Yes, Dr. Aronoff, we're able to see
great.
it. Thank you.
So we did ours a little bit unusual. An MOU could be a one pager, as simple as a one-page document. What we did is a little different. We did a belt and suspenders. We put everything in here, but it's actually not as complicated as it might seem. So party A would be us, party B would be this the school representatives. And what we found working with a school nurse was very helpful, as well as the principal and the school secretary. So we put down what we did, how we met, how we talked about the forms. We were careful about the school bell schedule. And we're just talking now about the school-based sealant program, which of course did close down during COVID. And we would screen the children first. We would get a consent. In one school district, we were actually contractors. So being a contractor means you don't have to get consent for every procedure. In the other school district, we were a not contracted. So, and that's more what this MOU is geared toward. So in that case, we had to get a positive consent from the parents to just look at their child, to do a screening, to provide the fluoride varnish, to provide cleaning, and also to provide sealants if necessary. And then we also have care coordination that helped out with children that needed care. We have a little part in here about emergencies, medical emergencies, the distribution collection of forms. And this is where I think it may be easier once we can go to e-forms. It's really hard to take all those paper forms and transfer all that information onto another paper form and then put it in the computer. And it's just, I'm hoping it'll be easier when we can do this electronically. And the same thing with the data collection. The quality assurance, we check the sealant retention at the end of the school year. That's fairly quick. And also we try to be very careful, and go back one, you'll have a copy of this, about the school and their days that they may have assemblies or the recess time, obviously lunchtime, important for the kids. And so that everybody knows what the other one's doing before we even start. And then of course the insurance and indemnification, and then you have termination for both parties in case things don't go as well as you're hoping, and then a clause for revision and addition. So it looks a little bit complicated, but it really does answer all the questions ahead of time, and I think that makes it a lot easier. So that is pretty much the end of the presentation, and we'll be happy to take any questions at the end.
Thank you so much, Dr. Aronoff and Yashvirkhar. Again, we'll be taking questions towards the end. So if you have any questions, please type in the Q&A box. Right. So we will be moving on to our final speakers. They are Amelia Golden and Erica Dawsey from Tuolumne County. Amelia joined the Tuolumne County Public Health Department in June of 2020 and has worked with community partners to help continue oral health education efforts in the county. And Erica Dawsey has served as a program coordinator and director of the Smile Keepers Dental Project for the past 27 years. Erica has specialized in pediatric dentistry for most of her 34 years in dentistry and operates the Smile Keepers Dental Project under the management of the Tuolumne County Superintendent of Schools. Welcome, Amelia and Erica.
Thank you, Keiko.
Thank you, everyone. Thanks for having us. Again, my name is Amelia Golden, and I am the project director for the local oral health program here in Tuolumne County, and I'm here with my partner, Erica. And she is the program director for the Smile Keepers dental prevention program here in our county schools. So for our portion of the presentation, we thought we'd share a little bit about the program we partner with, Smile Keepers, and the process we use for formalizing our MOU and how the pieces that we included translate into the practice. So I'll turn it over to Erica to share a little bit about the program with Smile Keepers.
Thank you, Amelia. As you can see, this is a pre-COVID shot, of course. We would have been wearing masks otherwise. But the Smile Keepers Dental Program is based out of the Tuolumne County Superintendent of Schools office. And our program, as we said, has been in existence for 27 years. We are a school-based dental disease prevention program providing dental education, basic oral screenings, fluoride varnish application for about 4,800 children in our small rural county in Tuolumne County twice a year. When the local oral health program developed at our local health department, we partnered on providing services for local school districts. And that's why we're here today, to just talk about our partnership and the unique arrangement that we have. A big component of our program, we are entirely grant funded, the Smile Keepers program. Have a large portion of our grant goes to First 5 services. So we provide oral health education, prenatal oral health education at our local hospital about every 6 weeks for new parents. The other partner in this program is Oceanariano, who is an RDHAP. I'm a registered dental assistant. We also have a separate program at the Tuolumne County Behavioral Health Program locally to help unsheltered and clients struggling with mental illness, and providing oral health education and preventive dental services. That took a pause during COVID. And recently our program was awarded a 5-year HRSA grant with UCSF to start a virtual dental home project in one of our rural county, up in the corner right near Yosemite. So we've been planning the last year to develop that. So we're really excited to partner with the local oral health program to provide services in our community, and of course, have used the Memorandum of Understanding format for all of the districts that we participate in. And especially what Mary Ellen talked about in the school culture, that is a very real thing. And schools are also a business. And that's a very important piece to remember when we're providing services in their kingdom, and that we are guests in that kingdom. And so I'm excited, just so excited to hear what everyone's been doing, and look forward to seeing how we can partner more.
Thank you, Erica. So, and hearing about the program, it seemed like a very natural fit, especially in developing our public health, oral health focused program within the county's public health department. And so how that kind of spurred and how we got to the MOU was through a lot of community involvement. Of course, one of the major goals of the oral health program is to get out into communities to provide education. Also, continuing to, like Erica said, develop those personal relationships. So working directly with Smile Keepers, working with, as Mary Ellen mentioned, the administration team at the school, getting people on your side and helping them understand what you do, so that that could translate into more formal partnerships like an MOU. And then again, like Erica mentioned, talking about our funding sources, so being really transparent about that and bringing all those things to the table so that we could get to the point where we do talk about an MOU. So how did we get started? Again, it was very organic in connecting with our community partners that were already out there. So the school was a big one, and Smile Keepers program was well regarded by the Office of Oral Health. So having that connection there and the support from the Office of Oral Health helped us get those initial conversations going. Again, the community involvement, so knowing that we were both out there trying to share oral health education and at a lot of the same community events, trying to share the same message. And finally connecting and talking about the shared vision we had. So how could we come together to expand and provide extra resources by collaborating? Another important aspect of that, which a lot of the other counties talked about, is agency support. So getting everybody on board, working within the county and then within the school systems, having everybody aware so that these more formal contracts didn't come as a surprise, and bringing all the ideas to the table. So letting everybody have a say in what they think would be a good way to improve our partnership, or how we could include different things that would strengthen our partnerships. So that brought us to our actual MOU, or as we like to call it, the professional service agreement within our county. And some things that we include are the term, which a lot of other counties talked about. Again, since we are a grant-funded program, we found that it was best to use a year-to-year or annual contract, and be transparent about the availability of funding. So maybe some years are a little bit more slim than others. Being transparent about that with both of our partners and everybody involved in the MOU process was really important. Our scope of work. So for our partnership, we talked a lot about the objectives of the local oral health, or the local oral health programs, expectations for, getting out into schools, providing assessments, doing fluoride varnish, and eventually sealants. So having everybody understand what that scope of work is going to be. Again, compensation is another one. So looking at your funding and what you have available to you and how that can fit into your partners, and making sure that everyone is comfortable and agrees with that. And then insurances. So I'll let Erica speak to this one.
Yes, as dental professionals, both Ocean and I hold California state dental licenses. We have elected pretty much from the beginning to carry our own professional liability insurance, as well as the liability insurance provided by our employer, which is the Tuolumne County Superintendent of Schools. It's a small yearly fee. We ask that anyone that works on our program carry their own professional liability insurance. And that was just something I wanted to mention, that it is making our services attractive, and we include that in our MOU that the providers carry additional liability insurance, because risk is always a big part of the conversation. And that's proven to be helpful for us in just ensuring that we are good, safe partners to have on campus. And, you know, we're going into our 27th year of service. So showing that you are a good partner to work with has been very attractive and helpful in our success.
Thank you, Erica. So yeah, finally, a lot of the county policies, so I'm sure for most of the counties, there are pieces that are required to be within any MOU or service agreement. So making sure that those are included and that everybody's aware of those stipulations for the purpose of finalizing that contract. So here's a little bit about how we formalize within Tuolumne County, and then how we work with our partner to get to the signature and formalized stage. So again, the MOU begins with kind of just these informal conversations between program staff, so like Erica and myself, and Ocean, talking about our ideas and what we would like to include in our MOU. Next, we'll loop in all of our experts, so department analysts who help us with our grants. On the Smile Keeper side, their HR team who helps with all of the compensation, our department directors and within the county, so making sure that they're okay with the terms of the agreements and everything that we have laid out. And then finally, it goes to our county council and superintendent for review and signatures. So what are some things to consider when, that we considered, or you can also consider when formalizing your MOU? So again, agencies, support, and resources is another huge one. Making sure that everybody's on board, everyone's aware of the resources that we're going to be providing, that we're partnering to provide, and how those will impact our respective communities. Sustainability, so again, being transparent about the scope of work, what's going to be required of each side, and the compensation that goes into that, and how that partnership can continue beyond, you know, like Mary Ellen mentioned, thinking ahead as well. So even though it's an annual contract, thinking ahead to how we can continue to sustain this partnership and provide services to our community. Data is another important one. So deciding who's going to be responsible for the data, how we're going to store it, collect it, and maintain its integrity. And finally, equipment and materials. So determining who is going to provide what, how those are going to be shared, and the responsibility of getting those to and from our assessments. So now that we've talked about how we got our MOU going, we thought we'd share a little bit more about how we can translate that into action and how the pieces of our MOU flow into our implementation plan. So when talking about our scope of work, some things that we determined for our partnership was helping with school assessment. So of course, with Smile Keepers providing the clinical expertise, being able to do the fluoride varnish, assisting with education, implementation, assistance with our COA programs, as well as our referral coordination. So helping families, you know, partnering to help families find a dental home, and continuing to educate people in our community, even that might be outside of the school-based services that we offer, working with them to help them get the oral health care needs that they need. So here's kind of just a snapshot of how all of those pieces come together with oral health education in the community, our assessments in the classroom, the data that we collect during those assessments, and working together. So Erica, I'll let you speak a little bit to this, but again, that kind of this portion ties into our scope of work and our agreements with that MOU.
And I may be telling a lot of you things you already know about working in schools, but it just really were just some pointers that we talked about in having a successful program. And having your teams and work together. You're never alone with the student. We always work in pairs. We always consider those arrangements every time we're in a school. We try and provide classroom education prior to any dental visits, whether it's screening, fluoride varnish, just to let teachers know what's going to happen, students know what is going to happen. People feel empowered and kind of excited to see the day. And with our schools, we schedule months ahead. And this is very helpful, as many of the other programs have talked about. Sending out schedules, teachers know what to expect. If there are changes, just good communication. And most of the time our teachers don't, or schools don't need to confirm with us because they know we'll be there. And if there is a change, we always communicate well. The assessment time in providing assessments is about 5 minutes a child. And of course, a lot depends on a lot in those situations, but generally, once a child hops up in our chair, it's about 5 minutes. We do a DMFS, which is decayed, missing, filled, or sealant categorization on our screening forms. And we're working on a digital platform for that. Everything we do is professional and clean, but it's simple. Try not to overthink what you need. Keep it simple. And we often use student volunteers in schools to help assist small friends going back and forth. This is a great way for students to get community service points and make them as part of the solution. And they can be very helpful. And, you know, provide creative activities while children wait. Talk about Rethink Your Drink or tobacco education or any of the other programs that you're committed to reporting on. And make it fun. Give children time to adapt. Don't be in a rush and be flexible. If, you know, the kingdom runs on a tight schedule, as Mary Ellen said, and successful programs are flexible. Many times we've shown up ready to go, fully equipped, everything set up, walk into a classroom, and there is a guest teacher or a substitute or an unexpected visitor. We offer the ability to be flexible. Rigidity does not work in school systems, and remember, you're always the guest.
Perfect, thank you, Erica. So just some other important components that also relate to the MOU process is the shared responsibility of how you're going to roll that out. So with us communicating on how we're going to roll out our consent forms, determining what data we're going to collect. So as Erica mentioned, the DMFS form, which we also had some support from the state on. So collaborating and determining how we're going to collect that, including that in the MOU of, you know, we have this goal and this is how we're going to accomplish it. And then determining the responsibility for follow-up too. So working collaboratively to create reports and get that information out there to families so we can continue both of our relationship in providing the dental services, but also outside of the classroom working with families to ensure that the recommendations are followed through. So a different spin on the MOU and how we put that into practice, but I hope that that's helpful. And we are happy to answer any questions.
Thank you so much, Amelia and Erica, and thank you to all the speakers. We would now like to open it up for Q&A. So we would like to invite all these speakers back. And we'll go ahead and start with the first questions that came in. So the first one is, are MOUs used when you don't have the funding to contract with an organization, or can you also provide funding with MOU? And Dr. Pendekar, would you like to answer this question?
I think I wrote in the chat, I mean, in the Q&A, I'm not sure what they mean by is funding provided for the MOU. Can you elaborate on that, please?
Yes. This is an anonymous question, so whoever wrote this would like to expand on this. Be more than happy to have the speakers answer this. But in the meantime,
but I think the first part of the question is, Is MOU required when there's a funded program? Is that what it's asking?
It looks like it.
I think so. I mean, anytime there's a shared goal or objective, or when, as many of the speakers have outlined today, when you're expecting your partner organization to do certain things and they're expecting you to do certain things, it's always a good idea to have some form of a written documentation that both of you can follow. So everyone is held accountable, and at the end of the day, there are no surprises or any assumptions as to who was supposed to do what. So I would say it's a good practice to have an MOU so that everybody's on the same page.
Anybody else would like to answer that or add to that?
I just wanted to add, I think it might depend on your particular organization too. And even the leadership style that your organization has or your department has. So some of them might require more things, than other ones would. But yeah, I think the answer was really good. I think it's just there's always a benefit to having things clear and for people.
Thank you. All right, so going on, next question is approximately how long does the MOU process take? If anybody wants to answer that question.
It depends, honestly. It depends on who's involved. Sometimes it could take months, depending on who you're partnering with and what's listed in the MOU. It could take a while, but I've had a partner organization turn around and get the MOU ready in a couple of days. So it really depends on who you're working with, and as Mary Ellen said, who's on the other side of the table. So I think the answer is either ways. It could be a very short time or it could take some time.
And usually the first MOU takes the longest. If it's something that a service you're going to provide year after year, then usually the turnaround is faster. But it's always in the beginning where everyone is a lot more tedious.
I think one example I'd like to give, we had I won't say what organization it was, but we met for a year. I had so many meetings with them, and every time we would meet, it would be like something new, and it wasn't complicated, and it really was just pretty much that we were going to give them some things, but the bureaucracy of the organization, we would go in and we would meet, and I go in and we meet for another hour, and then 3 months later we come back and look at it again. And I don't think we ever ended up actually having an MOU. And then we have had quick turnarounds, and even in dealing with the county structure, that can be really tricky. But even they turned around. They cannot turn around real fast. It's like one of those aircraft carriers is not going to turn fast. It's going to take a while to go around. But when there's relationships, sometimes you can start things that you wouldn't otherwise be able to. But yeah, we have done things really fast. Like I said, Santa Barbara Unified School District was amazing. They said our kids are back. Finally, they were the last ones to come back, and they said, we want you to come on in. So we made it happen.
So the next question is, what are collaboration situations where an MOU is not required? Has any of the speakers experienced this?
I mean,
Go ahead.
Go ahead, Deanna.
So I was just going to say, I think for something like COHA, the kindergarten oral health assessment, that would be pretty easy to do because it's through the state. If that's a good example, and some districts have done things where they do a screening day, and they will do, it's actually a great idea. They do dental screenings, vision screenings, and the hearing all at one time. And I don't know how that would be with COVID restrictions, and that was something else I was going to say. On our MOU, we did not include that. I think going into the fall, we will probably add something to our MOU about that, and just on our level, we'll probably look at doing screenings first and fluoride varnish, and then see where we go from there, and kind of feel where the school district is and where the parents are about providing sealants, even though if you do, non-aerosol generating sealant, but people don't understand. There's a lot of fear out there. And I realize that's not really quite what the question was, but I think as part of an MOU, you might want to have a clause about that or a paragraph, and just be very patient and work with people, because I think there's a lot of fear, and that should be also a part of the MOU. I'm not sure I answered your question though, but I did want to bring those points up.
And I think, like, for example, if you're going to be at a health fair, which we haven't had in a while now because of COVID, but moving forward, we probably will start again pretty soon with the state reopening. I think if you and your partners are going to show up at a health fair, I don't think you need an MOU for that. I mean, there's no, it's open to all, and you can just go there. You can have a conversation about who's going to do what, but I don't think maybe that's a situation where you wouldn't need an MOU.
Thank you. Next question, it's from Laura McEwen. She's asking, we had school districts who declined to sign an MOU because they could not commit to HIPAA guidelines since they follow FERPA. Anyone else have this experience?
So Keiko, if you don't mind, I would like to share this one MOU which has some language around that, and that might be a way to sort of address the situation with the schools. Is that okay?
Yes, please.
Okay, give me 1 second. I'm going to try this. Okay, are you able to see?
Yes.
Okay. Yeah, okay.
Yes.
So this just talks about the purpose and the responsibilities of the parties involved. Some of the other questions are around here too. So I'm sharing this real quick, and I'll make this available to anybody who wants it later. But talks about what the county will do, what the partner will do, equipment, supplies, and then the responsibilities of the school district, right? So what will the school district help with? And then the records, there was a question about records and what will be shared. And so here there's a clause about the records and what the county will do. And then if you look under 3B, it talks about the FERPA and the HIPAA. And there's language around that. So what will the county do? They'll keep a list of the students, and then those records will be secured manually and electronically to comply with HIPAA and FERPA. So I think this type of language might help with the question that was posed in terms of school districts not wanting, because I believe that is a requirement that the schools will want. And I think if you have something like this in your MOU, then it should work.
Great. Thank you, Dr. Pendekar. All right. So next question is,
Kiko, can I add something to that?
of course, please.
Yeah, so you might want to add to your process as how you would communicate with the parents. In our case, we used to use a sealed envelope when we were the screening results, although the teachers were distributing that for us, and then we also included a envelope for the consent form for the parents to sign and put that in the envelope, seal it, and then send it back to us. So that way the teachers were not really looking at the information or anyone else. It's just that our communication from to the parents. That might be something that you want to add in your process.
A good point. Thank you, Yashvirkhar.
Mm-hmm.
Okay. So another question is, says MOU includes a lot of items which we typically do not include. Just wondering why they don't form a contract instead. And the second part is, since the MOU is not legally binding, would it be lawful for us to request a COI? I think that's certificate of insurance based on MOU instead of a contract.
So we have language in our MOU regarding the insurance. And I think that's just most MOUs when there's some sort of services involved, as the school-based MOUs that we've had folks share today will have some language about that. So I think to answer the first part of the question, not doing an MOU and instead just providing the certificate of insurance, I'm not really sure how that would work. But when you do an MOU, then you would have a clause in there which talks about the insurance. I don't know if that answers the question.
Thank you. Yeah, that was from Elaine Wang. So if Elaine, if there are more questions, if you'd like to elaborate, please type it in the chat box. Since we have a couple more minutes, I want to go ahead and move on to the next question. So it says, what oral health data do you share back with the health department or with the school, principals or school nurses? Individual level data or aggregate de-identified data? So I think she's asking about what data to share with the schools.
Yeah, so again, I touched on this a little bit earlier. It will usually be de-identified aggregate data. But to give you an example, now when we do screenings at a school and we identify any child who maybe is a category 3, we are using COHA forms for most of our screening. And that would be a child that might need an emergency type of, or have an emergency type of situation, right? So whether it's a abscessed tooth or just a completely bombed mouth with multiple cavities, and you need to see this child, as soon as possible. In that case, what we've done in the past is we've actually talked to the teacher of the classroom where we are doing the screening, and then worked with that teacher to reach the parent and ask if this child has a dental home. And most of the times you're not going to have a dental home in such a situation because the child hasn't been able to see a dentist. And in that case, then we'll work with the teacher, with the parent, to try to get that child into to see a dentist as soon as possible. So I would say in that situation, definitely, we are identifying the child because we need to address the unmet need of the child in an emergency or an urgent case. But for all other purposes, it would be aggregate data.
Hi, I wanted to add to that answer. And we do provide both individual data and aggregated. When we meet with community members, all the statistics is share of the findings that we had per district. And also we have something that's called the outcome form, which is per class and roster, and just the way that it's provided because of HIPAA and FERPA, the delivery method has to be specific, but that is provided back to the queen or king of the castle so that they know the findings. And that's always part of also the MOU, which is who's gonna follow up on that data. And sometimes we don't have the staff power to be able to follow up. So we also collaborate with other family services agencies that either are part of the school or that might be just part of the community to help us follow up on the students and make sure that no child is left behind and that everyone's receiving treatment if they've been identified with a dental emergency.
As Jennifer was mentioning, in some cases we've used encrypted emails because we want to be very careful about sharing that information or delivering things in person. And in some cases where we're doing a specific follow-up, we will have it makes for a lot of forms, but not only a consent form, but a whole separate confidentiality form if we're going to do referrals and do follow-up, so that it's very clear that the parent is if they're giving us permission to release information for folks. So we try to handle all of that in the consent process, even if it takes 2 forms sometimes, and also in the agreement that we make with the school.
Yeah, good point, Marielle. And something to add, I think that was one of her other questions, that the school will not release information from the parent or any personal information. So the way that we go about that is that in order for us to provide the service, the parent has to consent and give us that information. So on the consent form, that's our opportunity to collect all the information from the parents, phone numbers and ways to contact them, so that when the screening is over, the service that has been provided, we're able to have that information from the parent, because the parent released the information, it was not the school. But for the most part, school will never release information. So it's via the consent form that we gather the data from the parents themselves.
Thank you. I know we are at time, so I wanted to thank all the speakers and all the participants. And then I would like to turn this over to Brian for the closing remarks.
Yeah, thanks, Keiko. And on behalf of the CPH Office of Oral Health, I want to thank all the panelists who presented today for just a wonderful presentation and all kinds of good information. Also, this is the last of our webinars as part of a series that we did for our most recent funding opportunity. So I also want to thank the folks at the California Oral Health Technical Assistance Center for all the great work that they've been doing in helping us host this webinar series. Developing MOUs and formalizing partnerships are a valuable strategy and tool that is really essential at building community clinical linkages and also implementing school-based and school-linked programs. So we work forward to working more with you in the upcoming days and weeks, and we're expecting that establishing MOUs will be an important part of the work that we do in the implementation period that we have ahead of us. So please reach out to us if you have any questions, and also you may contact your program consultants if you have any questions about developing MOUs. As far as an update on our most recent funding opportunity, for those who submitted applications, you should be hearing back from us in the next day or two about what your projected funding award is. So please reach out to us if you haven't heard from us. And as always, I want to thank everybody for attending today. And thanks, Keiko, for a job well done.
Well, thank you, everyone. Again, it's a pleasure to work with you and great information. And for those who are still on, if you have any questions, please go ahead and email me and I can go ahead and field those questions to the speakers. But great. Well, everyone, thank you so much and have a wonderful day.
Thank you. Thanks, Keiko.
Thank you.
Bye, everyone.